Good afternoon, everyone. Thanks for joining us. We are about to get started here, just giving another minute or two for folks to join. We see people are still being admitted, so thank you for your patience. And if you're joining us on Facebook Live but need interpretation, please join the link that's available there and you'll be able to access interpreters in Spanish and Vietnamese, Russian, and Chinese through the Zoom link. Great. Thanks for being with us. If you are here and need interpretation on Zoom, please go to the bottom of your screen and you'll see the icon that allows you to select a different language. Buenas tardes y bienvenidos. Si nos acompaña y necesita intérpretes, puede acceder el idioma en su pantalla. Tiene un icono así como un mundo, un globo, y ahí puede elegir español. También hay otros idiomas disponibles. We want to make sure people can make that transition. And here is our agenda for the evening. We have three main topics. The first one is regarding the child care substitutes of Oregon. We have guests here today to join us and share more about this topic. We'll also provide an update regarding the early childhood suspension and expulsion prevention program. We've brought this in the past, but want to make sure that you are informed and up to date on the greatest changes here. And lastly, we'll have some general information regarding agency and programs that we're happy to share towards the end of the hour as well. As a reminder, if you are joining us on Zoom, you have the Q&A feature where you can enter your questions, and we'll have time after each of these topics to address those questions. We have our amazing question moderator, Ronnie. And if you're joining us on Facebook, we are also monitoring the chat there, so you can enter your questions in the comments section and we'll answer those as we are able to. I think that's it in terms of logistics. So with that, I will go ahead and hand it to, here we go. Hannah and other team members, not quite sure who's jumping on, but thanks for joining us. You want to introduce yourself and then walk us through? I'll be here with the slides.
Thank you so much. Hi, everyone. My name is Hannah Annenson, and I direct the Child Care Substitutes of Oregon team here at Western Oregon University. And we are a program that is funded by the Department of Early Learning and Care, and we're really excited to be here today to talk with you about our program. Next slide. So who we are is really important in terms of us being here talking with you today. Is we are here to ensure that we can support and hire diverse substitutes to be out to support you in your early learning programs for any of the needs that you have both professionally and personally. And so on the screen here, you can see our mission statement, which is really for us to be able to support early learning programs in this new initiative. Next slide. So who we are. So at Child Care Substitutes of Oregon, we administer and develop the system. And so with that, we have a few different components of our system. One being that we onboard early learning and childcare programs into our system in order to be able to receive the 50 hours of subsidized time for a substitute to come in per calendar year to support your early learning program. So we work to hire and onboard subs for that purpose. So with that, in order for you to use your 50 hours, we have to have staff that can support you. And so we also hire and then provide professional development and support to substitutes. Substitutes that are coming out to programs are Western Oregon University employees. They are part-time Western employees. And we're really excited to be able to support and offer the service out to you all. And we are funded by the Department of Early Learning and Care. Next slide. So other thing to note about our program is we are new in our infancy. We're about 1.5 years old. And so with that, we have started really strategically in terms of the types of programs that we will be supporting. So program eligibility, in order for a program to receive their 50 hours of subsidized substitute services through our program, you must be a registered family child care program, a certified family child care program, a certified center, or a certified school age center. Currently, due to capacity, programs that are license exempt programs, recorded preschools, or license exempt Head Start programs, or programs that have access to K-12 substitute systems are not eligible for the 50 hours of subsidized substitute support in their programs currently. So if you are a program that would be eligible for our program, in the next slide, we're going to go into what it would look like to enroll in our program and how it can benefit you in the program that you offer. So in our onboarding process, we really want to make sure that it is streamlined and you understand what you are signing up for in terms of receiving substitute services. And then also we want to make sure that we are providing substitutes that have background in ECE, as well as have all of their required trainings in order to meet licensing compliance. So with that, if you own or direct a childcare program, the process for us in our program would be that you would fill out a program interest form. At the end of our presentation, there will be a QR code at the end of the slide, which you can scan, and it will take you to a link tree where you can see the program interest form, and you can fill it out at the end of this presentation, and we will get in contact with you. That's a way for us to then go in and verify your eligibility, your licensing status, and then move you on into the second phase of our process. We make sure that you know about our program. So we have an orientation video. It's about 14 minutes long. But it's really to help you understand the role and the purpose that we play in the system. And then we have handbooks in order for you to understand the policies and procedures that we have set forth for our staff. And also what we ask of you as you're welcoming our subs into your program. And then different consent and onboarding paperwork for you to fill out. Once we have all that documentation back, we also do have staff that is here to provide TA to help support you in any of the onboarding processes. Once we have that information back, we would then invite you into our database that we use, which is called Childcare Matters, which allows you then to post and request substitutes for shifts in order to have coverage in your program. Next slide, please. So how can you use your 50 hours? So if you are a program that would be eligible to use your 50 hours, you can use it for anything and everything that you see on the screen here. We've had programs that use it for professional development during working hours, attending a training while still being on site in their program with a substitute attending to the children. We have seen programs also use it, subs for assessments if they're having an assessment and want to make sure that they can give focus and attention time, or you can use it for vacation, illness, family needs. They are your hours to use to support your program, and we don't ask what you're using it for, but these are some reasons that people do use it, and we would love to see you engage with us to be able to support your program. Next slide. So the map you will see here is the map of Oregon that is broken down into childcare resource and referral regions. We have it organized this way because we know a lot of you are connected with your childcare resource and referral agencies. And so what you can see on the screen is where we currently have active and available subs that are field ready, which means that they have all of their trainings and have completed all of the hiring process here at Western Oregon University. And so currently we have 68 active substitutes across the state of Oregon. 39 are program ready, which you can see on the map here. Of those 39, 13 are lead substitutes, which means that they are teacher qualified, which is a huge benefit to programs in the regions. The other thing to know about us, because we are a newer program, is we had our first sub out in programs in June of 2023. So we are about 8-9 months old in terms of having subs out in programs and hiring staff. And so we are doing some targeted support, which is why we're here tonight, to really try to engage not only the early learning community and childcare programs, but also potential substitutes in order to help us continue to gain capacity in regions we currently have no substitute coverage across the state. I saw there was a question. Do we want to do it now or keep going? I assume at the end.
We can take questions at the end.
Perfect.
Have our monitor kind of walk us through those if that's okay, Hannah.
Perfect. Thank you. So then the next slide. So with that being a newer program, we wanted to show some data as to the coverage and where we currently have shifts being covered or job coverage for our substitutes. So from January 1st to March 15th of this year, we've been able to fill 1/3 of all jobs posted. So about 33% of all jobs that childcare programs are posting and that are being selected by those active substitutes. In that time frame, we have had 15 substitutes work 72 jobs for a total of 357 hours. And as you can see on the chart on the right-hand side of your screen, we did break it down by county just to show you where some regions are having trouble filling positions, which is where we're really wanting to work on some sub-recruitment. An example would be if you look down at Washington County at the bottom, we had 59 jobs posted in Washington County. However, we only had 5 filled. And so we know that the demand is there for support for our early learning programs, but we don't have enough capacity in staffing in order to help meet those. So as we go into the next portion of this presentation, we're going to really talk about if you know people that might be interested in part-time employment, that like working with children, what process they can go through in order to help support our program here in Oregon. And we would just love for your support in helping us spread the word. Next slide, please. So with that, we have found the most success in recruiting substitutes from subs that are currently already working in early learning programs. A lot of our substitutes come to us because they work in a center and they want to get registered in order for their program to utilize their 50 subsidized hours that we pay the sub directly. And so what's important to note is that these are part-time positions. Substitutes can only work 18 hours per week. And it is a process that would allow you to potentially use your 50 hours and allow that person to be paid for by us, but then also it would allow us to also help build capacity in the system if you guys like to share substitutes across programs. And so we really would love to see additional subs kind of come through in this process. There are a few requirements. Applicants do need to be 18 years or older, and they do need to be legally eligible to work in the United States per Western Oregon University and our HR processes. We have found that providers really like to kind of use our program first with people they know in terms of inviting them into their childcare space. And then we've also seen people grow into using additional substitutes that we have in regions as they've heard good things from their fellow peers. Next slide, please. So the process to become a substitute, again, at the end of the presentation in that QR code, in that link, you will also find information on the job postings and the application process. But if you are interested in supporting us in terms of seeing if you know people who would like to become a substitute with us, they would fill out a Western Oregon University job application. We have an interview process that they would go through. Once they accept the position, they would then complete all of the onboarding paperwork for being a part-time Western Oregon University employee. And then they would go into the training requirements piece. We do pay the time that people take to complete their training. So if you have someone that you're wanting to use in your site and you're also wanting to use them for our program as well, we do pay for them to complete their safety set of trainings as well as our onboarding processes. So they do need to complete a central background registry. They need to have their pediatric first aid and CPR, their Oregon food handlers card, and then do their recognizing and reporting child abuse and neglect, safe sleep, CPR and first aid, and then go through our different onboarding modules. Once they have completed all of their trainings and have completed an orientation with us to onboard as a sub for our Child Care Substitutes of Oregon program, then they would be ready in order to accept shifts that providers are posting in their areas in which they've indicated that they're willing to travel to. So each sub can put a range distance that they're willing to travel, and the system will notify them if a position meets the criteria that they're willing to work when they post up. Next slide, please. We do have two, and then you can, yep, apologies, didn't know there was details on it. We do have two types of substitute positions available. We have support substitutes, which are going to be aid or assistant qualified substitutes. And we have lead substitutes, which are teacher qualified. So we work with substitutes in order to determine if they are a support sub or a lead sub. And when you as an early learning program are indicating the support you need, you can indicate if you would potentially need a support sub or a lead sub or just any kind of substitute that would be available to accept the shift. And we currently work with all of our substitutes to support them in becoming teacher qualified if they have the capacity to do so. Next slide, please. So with this and being a new program, we are currently looking at expanding and hiring 3 full-time substitutes in the targeted regions you can see here on the screen with the stars in the counties. These would be full-time Western Oregon University employees. They would be working 40 hours a week in diverse ECE programs, and they would have full benefits and be a member of our team. And we are currently recruiting and trying to find full-time substitutes that would be in the Jackson, Josephine, and Douglas County area, Washington, Clackamas, and Multnomah, and then Marion, Polk, and Yamhill County. To help support our expansion, and then also see about how really we can have staff that are fully available if part-time employees are not available to support coverage in early learning programs. And so these are current positions that are posted online. We are seeking bilingual applicants if at all possible. We do currently have 8 bilingual substitutes in languages of Spanish, Chinese, and Vietnamese. And so we are looking at also expanding some of that. So if you know anybody that would be interested in really going out there and being in different early learning settings and supporting programs, we would love for you to send them our way. And again, it will be on the link tree in the QR code at the end of the presentation. Next slide. The other exciting thing about our program is we're currently expanding to offer our support for substitutes to programs that we previously were ineligible. So ineligible programs would have been license exempt programs, Head Start programs, or programs that have access to the K-12 subsystem. We're currently working on implementing what we call a private pay system, which would allow childcare programs to pay the salary of our substitutes in order to engage in our subsystem if they are ineligible for the 50 hours of subsidized support from the from DELC in our policies right currently. Additionally, if a childcare program uses up all of their 50 hours, which we do have a few programs that have already used up their hours for the year, it would allow them to continue to access substitutes that have already been in their program and pay the hourly salary for that substitute to us, and then we would pay the sub. So it will be a way that you can access if you use up your 50 hours and or if you were a previously ineligible provider in that process. Next slide. So the other thing to know about this is we are not doing this alone. We do have a provider advisory committee, which is made up of providers across Oregon. And it really is to help us inform our policies and procedures to make sure that we are developing this with early childhood at the forefront and making sure that it works for you and your programs. So we do meet quarterly on Zoom. We have 26 programs currently participating in our provider advisory committee. You can see the breakdown here on your screen. If you are ever interested in joining, please go ahead and reach out to us. We members that participate in our meetings receive an additional 4 hours of subsidized care per meeting. So if you attend all 4 meetings within the year, you do get an additional 16 hours of subsidized support from a substitute. And we do run the meetings in both English and Spanish. And we'd be happy to hear from you if you are ever interested in helping support us, as well as making sure that your voices are heard in how we implement and develop this system ultimately to support you all. Next slide, please. So as promised, here is that QR code. So if you have a chance, you can go ahead and scan it, and it will take you to our provider interest form if you're interested in having us support substitutes in your program, or if you know of anyone that would like to apply and become a sub, or if you could pass the word on about the full-time positions that we're also looking to fill to come out to programs across Oregon. We'd greatly appreciate it. Our email is on the screen and phone number, and we'd love to hear from you and support you in any way possible. And thank you so much for your time tonight. And I am now done. So if there are any questions.
Thank you, Hannah. And Ronnie, I know there were some questions that were answered through the chat, but I think it would be helpful for anyone who's not tracking if we could just do a voiceover of those as well.
Okay, thank you. And it sounded like we had just a little bit of time to cover some of those. So Hannah, could you tell me, there was a question about the 50 hours. Can you confirm that's 50 hours annually?
Yes, it is annually per calendar year. So it renews every January 1st of every year.
Thank you. And so if this private pay that you're looking at, there were a couple questions around if that becomes available for the private pay, but those that are actually eligible, would they get the first access to those substitutes?
So the way it works is we ask programs to spend out their 50 hours first and then go into private pay, if I'm understanding the question correctly. But yes, we haven't run into that yet, so I'm sure that will be something we take to our provider advisory committee in terms of who has access to substitutes first, private pay, or programs that have subsidized hours. But we have not run into that yet because we haven't started, but I will put that on the list to make sure we take to the PAC.
Okay, thank you. And there was a couple questions around, previously it sounded like an interest form or a substitute form was sent out, and they wanted to know if that was the same form that you were mentioning in the slides.
I'm sure there's lots of interest forms that go out, but if you fill it out 2 times, we will make sure to connect with you. So I would say if you are currently interested in supporting enrolling your program into utilize substitutes, I would say fill the interest form out currently, and then we will get in contact with you. But if you already filled it out, you may have, and we'll be in contact.
Okay, thank you, Hannah. And so Erica, did you have a question?
Ronnie, I wanted to add something about the form just for accessibility. The beacons link our link list that you might have scanned right now. I'm making a note right now to add that form to that list. So anybody who scanned that link or has that website, in a matter of like 10 minutes, if you refresh that page, the form that we're referring to will be on that resources page. It just wasn't published. So to anybody looking for it, it'll be there momentarily. Thank you so much.
Okay, thank you, Hannah. That looks like that's all the time we have for right now. And these slides will be available on our website with the recording of the program after the meeting. Thank you.
Ina, you're muted.
Thank you. Thanks again, Hannah and Erica, for all of that great information and to the great questions that were coming through. If there are more that come through and we're not able to respond, we'll make sure to get those to Hannah and Erica as well for them to reach out if we have your emails available. But you have those resources and we will share the slides for you to be able to access the different links and share along with your colleagues. At this point, we'll go ahead and transition over to Katrina Miller and Alicia Gardner, who are joining us regarding the Early Childhood Suspension and Expulsion Program. Thanks for joining us.
Thank you, Karina. It's great to be here this evening with all of you, and I'm glad to be able to share an update about this program and kind of where we're at and things that are coming. So I'm Katrina Miller. I'm the infant and early childhood mental health specialist with DELC, who's really one of the people who's helping to build out this program. So quick overview of the things we'll touch on tonight is, so suspension and expulsion happens at high rates in young children, birth to 5. And that is often a surprise to people, that young children experience suspension and expulsion at high rates. It's also something that disproportionately affects children of color and children with disabilities. We have been hearing from all of you, early learning and care providers need support to address those challenging behaviors in young children, because we know young children, just by the nature of their ages, have challenging behaviors sometimes. So DELC is developing supports with a lot of community input, and we're working on developing a continuum of technical assistance, support, and then enforcement for after 2026. So let's go to the next slide. I'll say a little bit more about a few of these things. This is the history of the legislation. And for some of you, you've probably heard all of this information before. Senate Bill 236 was passed in 2021, and it establishes a ban on the use of suspension and expulsion that goes into effect July 1st of 2026. And that ban will apply to any early learning and care program that is certified or registered, or that receives public funding. The other thing that is included in this bill is a study on the use of suspension and expulsion in early learning and care programs. So our partners at the Coalition of Communities of Color are conducting that research, doing that study, and that is due in September of 2024. The other legislation that was passed also during 2021 was House Bill 2166. And that is the legislation that established the program. And with the program, an array of services and supports. So it is these two things sort of go hand in hand. It's not simply a a ban that says you may not suspend or expel, but it is building more supports to provide those supports that you're telling us you need. It also, there is a requirement included that says that when a young child in an early care or education program is facing potential expulsion, the program will be required to request services from the program before suspending or expelling. Let's go on to the next slide. So here's a little bit about what we know about rates of suspension and expulsion in Oregon. So this comes from a survey of families, excuse me. So 9.1% of all families who have a child between under the age of 5 had that child was asked to leave care in the last year. 16.1% of children who were asked to leave care were African American or Black, which is the highest rate of any racial or ethnic group. 16.1%. 22.1% are children who have developmental disabilities or medical needs. 14% of the children were infants and 17% were toddlers. So even our youngest children are experiencing suspension and expulsion. Let's go on to the next slide. So those children are being asked to leave because providers need support, and you're telling us about the support that you need. So here's what we're hearing from you. We're hearing that providers, it's difficult to access the necessary support services, that there are high financial burdens due to staffing and meeting high needs. We're hearing from you about safety concerns, about how to keep children safe, how to keep staff safe, how to keep yourself safe. We're hearing about the emotional toll, how draining it is to deal with challenging behaviors and concerns related to legal liabilities. We also hear it is challenging sometimes to deal with parental disputes and emotional distress, and the emotional distress caused by those disputes. These are big things. We are hearing you. So call for state action. This is what we're also hearing from you. Providers are advocating for better support, more funding, and access to mental health services. There's also encouragement for greater parental responsibility and state protection for providers when parents do not partner. A lot of important feedback. Let's go to the next slide. So here is a little bit about the supports that we're building. In January, just a couple months ago, we identified new organizations, or I should say, funding for organizations to become new, what we're calling regional service providers. And they will provide infant and early childhood mental health consultation. Right now, those organizations are beginning with a period of planning. So the mental health consultation is not yet available, but they're working on getting there. So if you go down a few rows, you'll see regional service providers move from planning into implementation. And that will happen over the course of the coming year. Each region will be on a little bit different time frame. So back up to where it says February. regional inclusive partners. These are new positions in CCR&Rs that are being developed currently, being funded currently. We're also identifying a new agency that we're referring to as a central entity. They'll provide central coordination and training for mental health consultants and for other technical assistance providers across the state. I already mentioned the research study that is due in September of 2024. We're also building what we call a warm line, which will be an online access point to make it easier to access support. There will be a requirement to access the warm line when a child is at risk of suspension or expulsion, but it will also serve as a way of accessing services proactively early on before it gets to the point of suspension or expulsion. And finally, in July of 2026 is when the prohibition on suspension and expulsion goes into effect. Let's go to the next slide. So this is, I think, Allison or Karina, if you have a time check for me, but I'll go through this briefly. So this is what we're calling our coordinated system of support. And this is, again, about providing a way for you to receive services, support services. So you'll see with number 1, it says early childhood educator identifies a need for support. And then it follows through from there so that that request for support is received and a response is given, and we provide the support that you're looking for, and also hopefully maintain that child's placement. All right, let's go to the next one. This slide by itself could have been our whole presentation, so we'll come back and spend some more time another time. We have an advisory group that is meeting monthly to help guide us in developing this program. It includes the roles that you see. It's 17 people, parents, childcare providers, 2 representatives from the childcare union, people who are providing technical assistance, other specialized services, mental health consultation, and community partners. And I think with that, I am tossing it to my colleague, Alicia.
Thanks, Katrina. Good evening, everybody. I'm Alicia Gardner, and I am the Child Care Licensing Division Director. I'm going to talk to you a little bit about the enforcement of the suspension and expulsion ban. Senate Bill 236 passed in 2021, as you heard Katrina talk about, and established a ban on suspension and expulsion, which will be effective July 1st, 2026. This ban will include all licensed childcare programs and programs receiving public funds. House Bill 2166 also requires licensed childcare programs to request services from the Early Childhood Suspension and Expulsion Prevention Program when a young child is facing potential suspension or expulsion. The legislature in these bills also required DELC to provide a report late last year, which is posted on our DELC website, on how DELC proposes to enforce the ban. In that report, which you can find on our web, that you will see that the current ban does not name in any way to enforce the requirement. DELC is recommending in that report that an amendment would add a new subsection to grant the Early Learning Council the authority to approve rules regarding the investigation and enforcement of matters involving suspensions and expulsions. This will allow the Early Learning Council and DELC to create clear rules with processes on how investigations and enforcement of violations of the ban will be carried out. Granting the Early Learning Council rulemaking authority around suspension and expulsion will also address another challenge in implementing Senate Bill 236. Because Senate Bill 236 is currently written with not much flexibility. It doesn't give the Early Learning Council rule-making authority, nor does DELC have any discretion in the enforcement of the ban, and it will limit DELC's ability to use a contextual and flexible approach when enforcing the ban. And so, for example, if there was some sort of abuse or neglect in a childcare facility, currently right now, a facility would violate a ban by expelling that child in an effort to protect the other children in care. So DELC is recommending that the statute should be amended to provide for rulemaking authority in order to put in appropriate exceptions and other requirements, including those described in House Bill 2166. I will note that it's important to know that CCLD does have definitions for serious violations in each of its rule sets. And as these definitions stand today, if the suspension and expulsion ban were a part of the licensing system, violations for suspension and expulsion rules would not fit into the definition of serious violation as a singular violation. And therefore, that means we can address these violations with technical assistance. Technical assistance in this case would be a referral over to the prevention program. I will note that CCLD is obligated to make findings on a complaint currently. Thank you, and we can move to the next slide. And if there's any questions, we're happy to answer.
Yeah, Alicia, we have just a little bit of time, so I'm going to kind of condense some of these questions. When Katrina was talking describing the data of children that were asked to leave, did that include anything other than the children, such as parents not paying a bill or disagreements with a parent? That were those that were asked to leave had anything to do other than the children?
That's a really good question. And to fully answer, I would need to go back and look at exactly how the question was worded. So I can't quite answer that fully, but what I can say is that the suspension and expulsion prevention ban is not intended to insist upon you maintaining families who are not paying. It is not intended to be a payment. Yeah.
Thank you. Or a disagreement with the parent. Okay. Yes. So thank you. Again, real quickly, could either of you talk about the timeliness of the assistance that might come in? Are there requirements for the resources to be timely so that, okay, can you speak to that, please?
Yeah, that's a great question. So right now, we haven't put timelines on it because the resources are not yet available. But there will be another rulemaking process at the time when services become available, or at the time leading up to when the ban goes into effect, where we will address timelines of response.
Okay, thank you so much. I'm going to sneak in another quick one. Do you know if there are support services available now for non-DHS parents in the Southern Oregon area?
I don't know, I'm afraid.
Okay, thank you. I think that's all the time that we have now for these questions. Thank you.
Thank you.
Thank you, Katrina, and thank you, Alicia, for joining us and sharing this update. I know that there is a lot of information and perhaps more questions surfacing for folks, but we can drop those in here. Also, you'll be able to find information on our website as more updates regarding this program come together. with that, we'll go ahead and transition over to our agency and program updates. And I think we have Alicia also queued up here. So welcome back.
Thanks, Karina. So I do have some exciting updates from CCLD that I'll run through in the next few slides here. The first one I have for you is that we are currently working on a revision of the certified family and registered family rule sets. We are looking to get your feedback if you are an individual who works in a certified family or registered family home, or you are a license holder, a childcare provider. And what we're interested in hearing from you about is knowing which rules you would like to see changed and why. And so this is very valuable input for us. We've been using this feedback we've been receiving in this form, as well as conducting some listening sessions. And if you participated in those, thank you. But the form is still open, and we would really value your input if you have anything to say regarding the rules that you would like to see changed and why. The link there is at the bottom, and you'll be able to click on that. It's also on our DELC webpage. Next slide. Next, I'd like to talk about a new dashboard, which is available on the DELC web. This dashboard is very exciting, and it's going to provide anybody who's interested information on the number of licensed facilities that are in the state of Oregon, broken down by type. So broken down by certified center, certified family, or registered family. It's going to include the number of facilities statewide, and you can even break it down by county level on a map. And then it will also show the licensed capacity changes over the time and the license type changes over time. So I did include a screenshot there on the slide of one of the views of the dashboard, but note that this is an interactive dashboard, and I invite you, if you're interested, to go to that webpage there on the slide, and you will be able to click around, look at the different tabs there. There's some yellow tabs at the top to look at the different ways we can present the data to you. And we hope you find this interesting and useful, and that you see that it's just one of the many improvements that we're working on in our website to show transparently our data within DELC. Next slide, please. All right, and then lastly, we have a lot of upcoming rulemaking in the works, and lots of opportunities for you to get involved and get engaged. We really love hearing from the individuals who might be impacted by the rulemaking, and we really love engagement at CCLD, and talking to the practitioners and the early learning professionals out there about how we can make systems better is something that gets us really excited. So I'll just briefly touch on the 3 different types of rulemaking that we're doing. Right now, we are ramping up to run a micro center pilot program. This is a result of Senate Bill 1040, which passed last year in 2023 in legislative session. This bill requires CCLD to select just 3 programs for a micro center pilot. We are going to be passing, we're going to be proposing to adopt those rules March 27th with an effective date of April 1st, 2024. Those rules will really only outline how we are selecting individuals for the pilot. Again, I said we were updating certified and registered family rules. You can see the important dates there on the slide. The most important dates, I think, for you is that if you're interested in participating in a rule revision work group, that application opportunity will be coming out very soon, and we'll be running that work group in early summer of 2024. Also, there's some a RAC to follow after that, which is application based. Then public comment period will begin in September, which is open to everybody. And then we will propose those at the Early Learning Council meeting in December of 2024 with an effective date of July 1st, 2025. So that will give childcare providers 6 months to learn and be trained on the new rule changes. Lastly, we have our outdoor nature-based childcare project. This is a result of House Bill 2717, which directs DELC to create a new type of licensing called outdoor nature-based, and this is going to be for programs that are operating in the outdoors. We have a community rule work group running right now. And we will be running a rack for that late fall 2024. And then you can see there that we are looking to get those rules adopted in March of 2025 with an effective date of July 1st, 2025. And that is it for me. Thank you.
Thank you, Alicia. Ronnie, not sure if there were any specific questions for this so far.
Alicia, will the dashboard eventually include license exempt providers?
That's a really great question. Eventually, I think that we will get to a point where we can include that data. We're still working through the best way to possibly present that. And you will see over time that there will be other dashboards that are popping up on the DELC webpage, and we'll announce those as they come out.
Thank you. One last question. Has there been any progress of giving childcare centers their own ability to pull up their own staff qualification training logs? It would be a lot easier to track.
This is a really great question and something that we're really looking forward to in the day that we can also provide this to childcare providers and center directors and those who are looking to get this training log. Right now, it is still the process that you need to reach out to either customer service or your licensing specialist in order to get an updated training log. But we do know that this is an efficiency that the system and we internally do want, and we know the field also wants. And so we are working towards that, though I don't have an answer for you right now on when that change will occur.
Thank you so much. And that'll be it for you for now.
Thank you so much, Alicia, for that information. I know we are running close to the end of the hour, and we have just a few more things to touch on. This is a quick one-slide view of the 2024 short legislative session, so just wanted to come in and provide an update. Overall, it was a very successful session for early learning and childcare. DELC did receive all funding and positions requested, and we were able to see those investments above what we requested for the employment-related daycare. And you can see that number here on screen. It means that we should have sufficient funding for the program, but families will remain on the wait list at least through the end of this year. So you can see that there was the 99.2 million for the employment-related daycare, plus the 72 million in additional funds if necessary. That wait list again continues to be in place. There's also the 9.4 million that was approved for the Birth Through 5 literacy plan. This was essentially the release of these dollars from the plan that was adopted in the 2023 session, but 4.7 of those $4.7 million will go into the early learning hubs, and then the remaining will be open for application through what will be established as the Birth Through 5 literacy program. So more information to come on that as this continues to develop. And then lastly, the establishment of the CHIPS Child Care Fund, which targets funding to build new childcare and provide care for those who are involved in construction apprenticeships for workers, building semiconductor plants. And so seeing a connection here from different workforces. Just wanted to make sure to provide this for you. It was a short legislative session, and we didn't have a lot of conversations about this. I think last time that we had an information session, we were just about to jump into session. So I wanted to provide this, and don't see any questions coming through. So I'm actually going to jump on to the next one for a quick update on the strategic plan. Some of you might have joined us last month and engaged in, we did a transition for some conversations around the strategic plan. DELC is developing its first strategic plan as a Department of Early Learning and Care, and has been since late fall gone into conversations with different programs, partners, including childcare providers and families and caregivers, to gather some of the greatest priorities and hear about the most urgent needs for children and families. And so you can see some of those questions that were asked on this slide, and in the blue box, and then the yellow box that holds a quick review of the different groups that we engaged and had conversations with. But more importantly, wanted to come back and give an update on some of the themes that were captured from these different conversations. You'll see those here. And more importantly, in broad terms, what we heard in many of the conversations, if not all, was really the need for increased supports and resources for children overall, right? And I think this catches no one as a surprise. Another big one was regarding supporting the workforce, and whether it be in compensation and benefits, professional development opportunities, looking also at diverse, the quality of professional development, but also the language accessibility of those, so that providers can serve children and families in their native languages in different regions of the state, for example. And then, of course, some things related to the operations of the department, which we are still establishing as an agency. And so, and for requests and needs for stronger systems, for improved communication, for improved accessibility and resources. So these are themes that are captured here. And then just very quickly, there are a few draft goals that our team has established based on the feedback. Again, these are drafts, so nothing is necessarily in place. We wanted to come back and share these with you, and we'll have a link for you to, if you're interested, to type in some of your feedback and comments on these, which we'll go ahead and drop into the chat. And there is an English and Spanish form. But the goals surface around both program and then operation pieces. There's a goal around access here, tribal sovereignty, a goal related to infants and toddlers. Number 4 here is related to workforce. And the other half is cross-sector partnerships, so collaborations with different state agencies, but also regional partners. Found 6, 7, and 8 are more operational pieces. So looking at the department's foundations and establishing trust and relationships with communities and partners. Won't go into these in detail, but if you are interested, we'll have the link available for you. Just dropped it into the chat here as well. And you can provide your feedback, thoughts, reflections on these different goals. Want to make sure that you have another opportunity to provide some of that feedback before we finalize and move on to, before we move on to the next phase of the strategic planning, and before this is finalized by the end of June, which is our ultimate goal. That is all of the information that we had for you. I've been watching the questions. I don't see anything. Ronnie, do jump in if I missed something.
Nope, you didn't miss anything.
Okay, great. Recognize we are at 7 o'clock. So this was a dense informational meeting, but really appreciate your participation, for joining us. You'll find the slide deck on the website, on our website. And also invite you, if you have not yet subscribed to the childcare updates, to please do so. Those are coming out on a regular basis now, and it's one of the best places to be able to get information, up-to-date information and resources from our teams. Thank you so much for joining us once more. We will see you again in May. Thank you.